Assalamu alaikum doctors. In this video I am discussing history. It's a very common history, comes on repeated time. So the child chief complaints may present with chronic diarrhea or bloody diarrhea, pararectal bleeding. Normally it comes the child present with elder brother. I am telling there is a take a history from a 12-year-old boy who is accompanied by his 16-year-old brother. The 12-year-old has a history of pararectal bleeding. Another time it's come as a child has chronic disease who has recently moved to the area. So that is a known case and exacerbation occur. Another Crohn's disease plus diabetes mellitus develops. So diabetes mellitus feature will find like excessive drinking water and excessive pee. Another come like a 9-year-old boy with Crohn's disease for 2 years on omeprazole, azathioprine. These are concerned on the poor weight gain. Look for the causes of weight loss. Associated disease with Crohn's disease causing weight loss, side effects of medication causing weight loss, and discuss on management plan. The child is maybe taking lots of drugs recently and weight loss occur. So it is the side effects of medication. Now I am telling how can we take the history. The DD our mind when pararectal bleeding comes, that is celiac, Crohn's disease, cow's milk protein allergy, and cystic fibrosis. So pararectal bleeding or loose motions. First of all, diarrhea, chief complaint analysis, OCD, onset, course and durations, what make it better and what make it worse. However, the frequency of the passing poo, amount of the poo, color of the poo, order of the poo, the consistency. Is that painful pooing? There is any mucus, blood, undigested food, difficult to flush if using toilet, greasy, and if using diapers. Then nocturnal diarrhea and urgency swelling. Okay. So poo description we will ask. Then GIT increase the tummy size, tummy pain, throwing up, alternated with constipation, and ULS discoloration of eye, oral thrush, oral or anal soreness, and anal itching. So alternated with constipation is very important. Generally FWSL, fever, weight, activity and sleep, appetite, food refusal, nutrition type, if formula fed, who prepared it, how it is prepared. If breastfeed, mother on any special diet, iron, calcium and vitamin D supplementations, weaning, type and amount, weight loss, early, that is clothes and growth chart. Other concerns like any dysmorphic features, chronic illness or long-term medical conditions. Urine about the pee concern, amount, color, frequency, frothy pain and blood pressure we will ask. Then go the endocrine, hot intolerance, thyroid and diabetes. Then hematology, pallor, bleeding and recurrent bugs, MSK, skin spots, that is fingers, oral or anal flexures, itchy or not, describe then lumps, swollen glands and joint pain. Chest about the recurrent bugs and cough. Serious heart racing, exercise intolerance and fainting, CNA, sign of increased ICT signs, abnormal movement, abnormal gait, fits, numbness, previous bug, vision concern, red eye, hearing concern, behavioral changes and irritability, then swelling anywhere, any neck swelling, hair or nail, bone or joint pain and back carving. Past 5T IOA, the team, dietitian, drugs, side effects of steroid. So side effects of steroid also search. And 5T, that any previous trauma, travel, treatment taken, team involved, blood transfusion, surgery, these are. Parental history, the pregnancy, maternal disease, drugs, illicit drugs, delivery time, type and fast cry. Postnatal NIQ admissions, meconium passage, yellowish discolorations, belly button loss, heel prick test and hearing test. Puberty, if it needs time, then vaccination history. As usual, allergy, foods of anything, nutritional as usual, development in detail if less than 2 years. Then family history of similar conditions, all atopic march or if cow's milk protein allergy, social, financial, home, school, psychological impact, how does this condition affect the family. So this is all about how can we take a Crohn's disease history and also pararectal like loose motion history. All history are same. So remember the Crohn's disease features I am telling, that is intestinal manifestation and extraintestinal manifestation. Intestinal ulcer are we find aphthous ulcer, that is oral ulcer they complain, abdominal pain complain, primary sclerosing cholangitis, that is yellow discoloration, jaundice, right iliac fossa mass, loin pain, diarrhea, blood, mucus. Extraintestinal are arthritis, arthralgia, eye, there is uveitis, episcleritis, conjunctivitis, pallor and jaundice, skin, erythema nodosum, pyoderma gangrenosum, renal stone, fever, sweats, then carcinoma develop in Crohn's disease. Remember sweating we can ask night sweat because carcinoma develop in Crohn's disease. Thank you.